Important medicines after getting a heart stent. This video is for patients who have had a stent put in their heart. First, let's start with an overview of what a heart stent is. This is a picture of your heart. Your heart is a muscle. Its job is to pump blood to the rest of your body. Just like any other muscle in your body, the heart needs blood in order to work. These blood vessels supply blood to the heart. Before you had a stent placed, there was a blockage in one of these blood vessels. A stent was placed to open this blood vessel and improve blood flow to your heart. Now, let's start talking about your heart stent and the medicines you will need to start taking. Patients who have had a stent put in their heart usually need to take at least 3 medicines to prevent future heart attacks, as well as problems with their stent. One of these medicines is a cholesterol-lowering medicine. The other 2 will help prevent clots. Aspirin, which you are probably familiar with, is one of them. The other is a blood thinner, which we will discuss on the next slide. Taking these medicines as your doctor has instructed is very important to prevent you from having a heart attack in the future. In addition to aspirin, you will be taking one of these blood thinners. This chart shows the drug names, brand names, as well as a picture of each medicine. However, the tablets may come in different colors, shapes, and sizes depending on where you receive your medicines. The medicines are clopidogrel, which is also called Plavix, ticagrelor, which is also called Brilinta, and prasugrel, which is also called Effient. Your provider will help choose the best medicine for you. As we mentioned before, you had a stent placed in one of the blood vessels of your heart to open up a blockage. If you do not take aspirin and the other blood thinner we just discussed, a blood clot can form in the stent, causing a life-threatening heart attack. It is important to take your medicines every day, as your doctor has instructed you to prevent problems with your stent. All of these medicines work to decrease your risk of having a heart attack. You will take the cholesterol-lowering medicine and aspirin until your doctor tells you to stop. The additional blood thinner, which will either be clopidogrel, ticagrelor, or prasugrel, is usually taken for 1 year after a heart stent. However, the amount of time you take this medicine will be different for each person. Your doctor will help you decide how long you will need to take this medicine. Please remember, never stop taking any of these medicines without first talking to your heart doctor. Many people wonder what side effects they can expect with a medicine. Aspirin and other medicines that prevent blood clots make it more likely for you to bleed. It is rare to have a lot of bleeding, but if you are worried, talk to your doctor or go to the emergency room. Some patients experience shortness of breath while taking ticagrelor. If you are concerned, please talk with your doctor. However, please do not stop taking your medicine unless your heart doctor tells you to do so. Some people have trouble taking their medicines every day. Some reasons for this are forgetting, trouble paying for them, and having trouble getting refills. Please talk with your provider or pharmacist about any problems you have with taking your medicines as instructed. Some ways to help you take your medicines every day are setting alarms on your phone, using a weekly pill organizer, and being sure to refill your prescriptions before you run out of medicine. Although you may be asked to stop taking your medicines for a short while for medical reasons, please do not stop taking them without first talking to your heart doctor. It is important for your providers to know about your medical history. Tell your healthcare providers you have a heart stent and the medicines you are taking, especially for your blood thinners. This will help them plan the best and safest care for you. Thank you for watching. We hope what we have talked about in this video will help answer some questions you might have had about your medicines that you will need to take after getting your heart stent.